Good afternoon, everyone, and welcome to the Foundation for a Healthy Kentucky's Health for a Change webinar. Today's webinar title is Kentucky-Inspired Community and Capacity Building. My name is Rochelle Seeger. I'm the Community Health Research Officer here at the Foundation, and I've been honored to have been working with the Foundation since 2013. So my main work at the Foundation is the annual Kentucky Health Issues Poll that the Foundation sponsors in partnership with Interact for Health. I also work on the data website, KentuckyHealthFacts.org. And a great piece of my work here at the Foundation is supporting this training series we call Health for a Change. And I'm glad you've joined us today. A few points about our webinar platform. In just a moment, if you're having any audio trouble, you can check on your speakers, and I will send out the link to the telephone number where you can call in if for any reason you're having audio problems. You can dial in by telephone and listen to the audio via that line. So I'll do that here in just a moment. A little bit about the Foundation before we get started. The Foundation for a Healthy Kentucky was founded in 2001. And the Foundation's mission is to address the unmet health needs of Kentuckians. We do that by developing and influencing policy, improving access to care, reducing health risks and disparities, and promoting health equity. The Foundation for a Healthy Kentucky website, healthy-ky.org, has a lot of information about the Foundation's current work, reports, and also you can sign up to receive the Foundation's email newsletter list there at the Foundation's website, healthy-ky.org. You can also find the Foundation's news releases also listed there on that website. An initiative of the Foundation is the Coalition for a Smoke-Free Tomorrow, and that work is working to install policies and practices so fewer Kentuckians are smoking and fewer Kentuckians are exposed to emissions from cigarette and tobacco smoke. You can check out all the work for the Coalition for a Smoke-Free Tomorrow on their website, smokefreetomorrow.org, where you can sign up and also join their mailing list as well. Another announcement I want to make is regarding the Foundation for a Healthy Kentucky's Community Advisory Council. The council's role is to provide the Foundation Board of Directors with advice and recommendations regarding policy and strategic direction, and to serve as a liaison between this organization and communities across Kentucky. So I wanted to remind everyone that more information about the Community Advisory Council is available on our website, and nominations for that group are open to Kentuckians. So nominations are accepted on an ongoing basis. And right now, the Foundation is looking for some folks from Kentucky that are from the following area development districts: Buffalo Trace, Five Co, Gateway, and Cumberland Valley. Also, we're looking for individuals who bring racial ethnic diversity to the Council, and individuals with lived experiences from underserved communities. For example, they have been a Medicaid recipient and those from rural areas in Kentucky. But please look at the website where you can find all the information about these different guidance, the role of the council member, and also the nomination form. You're welcome to nominate yourself or nominate another Kentuckian to the Foundation for Healthy Kentucky's Community Advisory Council. A few more announcements before we get started. I do want to remind everyone about the 2020 census. Maybe you've been on one of our census webinars last year or earlier this year on the importance of sharing that information through your organizations, through your neighbors, through your churches, through your workplace. Kentucky still needs to have folks complete their 2020 census. In partnership with the Kentucky Nonprofit Network, there's a great website with a lot of information about Kentucky census information. And of course, I want to remind you that you can go to the 2020census.gov either to complete a census online or to find more advertising information for partners who are interested in supporting the 2020 census. So it's not too late for people in Kentucky to complete the 2020 census. Back to this Health for Change training series, why we're here today. The foundation started this training series in 2011 to support people just like yourselves who are working to improve health across Kentucky. They may be advocates, people in health departments, people at local universities, community members who are interested in learning more about supporting health across our great state. This photo on the screen is from last summer when the foundation and our friends joined farmers Michelle and Nathan Howell on their farm in Allen County, Kentucky, and learned about all of the great work of the community down there that's connecting food to school and food to health department, and how folks in that community are working together to make health improvement. A recording of this webinar and prior webinars are on the Foundation for Healthy Kentucky's website. You can check out the Events tab and Health for a Change. So you have access to the slide decks as well on that website. Finally, I want to invite you to the next webinar in our series, which will be held on August 4th, same virtual place at 12 p.m., where we'll be talking about working across different organizations to streamline services in response to COVID-19. So that's healthy-ky.org on the Events tab. On this web platform, please, if you're interested in asking our presenter today questions or you have comments, we would love for you to use the audience chat function, and that comes in straight to us, the presenters here on the webinar today. So please take advantage of that so that we can have a dialogue with you and have your question answered on today's webinar. And this Health for a Change training series is all about partnerships. So I'm thrilled to have worked with many great individuals and groups across Kentucky, including the Kentucky Center for Smoke-Free Policy at University of Kentucky, Kentucky Injury Prevention Research Center, many universities in the Kentucky college system, Jessica Bellamy's work on data and data equity as part of the Root Cause Research Center. That is a picture of Kane Community Kitchen, the chef there with his arms raised in victory after feeding us there in Whitesburg, Kentucky, and folks with the Kentucky African Americans Against Cancer. They're celebrating cancer survivorship. This is about partnerships, so again, I invite your ideas for this training series as well. And I'm thrilled to turn over the call today to a partner who I met in the Louisville community maybe 10 years ago out at a community event. I'm thrilled to have met her there and learned about the great work that she's doing, and I'm happy to turn over the call today to Devon Edwards. Devon, welcome. I'm so glad you're here with us.
Hi, everyone. Good afternoon. I am Devon Edwards, and I have been working in the field of public health for about 10 years. And if you are new to the field, welcome. If you are not, then I hope we have crossed paths across Kentucky over that decade or so. I currently do private consulting through Chenault Solutions, and there's information there if you would like to contact for more after this webinar. I have served as a volunteer, board member, a grantor, an evaluator on the local and national level for health initiatives of all kinds within the nonprofit and the government sector. And I'm so proud to celebrate the 3rd anniversary of my business this month, which is really great. It's a wonderful milestone to be self-employed and be able to do this work with organizations and for causes that are dear to my heart. I've had over 20 plus clients and have been able to work with organizations raising over $500,000 in funds over that last 3 years. And so what am I working on right now? We'll move to the next slide. And so right now, there we go. So right now I am working on strategic planning. Working on strategic planning, board development, program evaluation, fund development, and executive consultation. And so Chenault Solutions is a capacity building firm. That means we work to make your teams better. There's also a leadership development component that my colleague, I also partner with another organization, and my colleague takes over that part. It's because I'm a right-brain individual, and I really focus on outcomes for your organization, making sure that you're tracking your success and that your team knows the ins and outs of their roles and responsibilities in order to make the vision and the mission happen. And so with strategic planning, I work with different teams on 3 to 5 year plans. Considering our current climate right now, that timeline looks a little bit less, probably 1 to 2 years, considering that we are in an unsure state, very nebulous. And I also work on board development, making sure your board members are equipped in knowing their roles and responsibilities and how to best support. That could be advisory board, nonprofit board, any types of board members that you have. Program evaluation is very important, and quality improvement. Rochelle mentioned the Root Cause Research Center, and so a theme within the program evaluation is making sure that there is data equity, making sure folks are collecting information in a way that speaks to equity, that reaches everyone that you reach, and also collects the information that you need in order to improve. And then there's fund development. So that could be anything from grant writing to identifying funders, to identifying private funders in case you have a foundation arm to the work that you are doing. And then also executive consultation in case there's any one-on-one consultation needed to be more familiar with the infrastructure of an organization and how an organization should work. And so all of those pieces together really define capacity building. It takes different forms and different methods, but it's building the capacity of individuals to make sure that the mission and vision are successful and there is impact within the community. And so I really wanted to dig into this in an informal way. So while I'm talking, I can't see you, and we've been through quarantine, so I don't still want to feel like I'm quarantined from you. So if you could, feel free to submit questions and comments in the chat, as Rochelle had said before, as I'm talking, because I'm really going to open up this conversation to Q&A in order to explore the idea of capacity building, especially within the climate that we are. And so what is the climate? Well, we have physical health issues as well as social health issues that are emerging at the forefront of everyone's mind right now. And of course, under physical health, we have COVID-19 and the current response to COVID-19. Public health should be shining right now. I appreciate for those public health departments that are on the line. We appreciate everything that you are doing to maintain the health of your populations. And for those nonprofits that are on the line, we appreciate everything that you're doing to address what has happened because of the response to COVID-19 as far as providing basic needs to the clients that you serve, addressing new needs that you possibly have not addressed before, and you're trying to figure out how that works. So COVID-19 has really changed the way that we do business. It has changed the way that we impact the community. And as far as social health, we have an emergence and a growing awareness of inequities as far as race, as far as systemic inequities across the board, whether it be through healthcare, which has been also exposed by the response and treatment of COVID-19, but also within the law enforcement system. And so this has been an unprecedented response to those health issues, social health issues across the globe, not only across all 50 states within the United States, but across the globe. And so you have the themes of Black Lives Matter, and you also have the magnifying glass on police and community relations. And these pieces affect the work that we do, right? They really do, because organizations have begun to respond in different ways to both of these climate issues, as far as physical and social climate issues. And the responses have focused on sustainability, and accountability. So the two main responses have been sustainability and accountability, especially within the capacity building realm, okay? And so that has happened in a number of different ways across organizations. And in leadership, right, leadership is where capacity building really starts, because you want to make sure that you have a strong leadership team, that you have strong executive leaders within your organization. So leaders have begun rethinking strategy. Also, making public statements that better define their values and the value shifts that they possibly have had to take in order to adapt to the current climate that we are in. There has been a greater focus on diversity, equity, and inclusion. And then also a greater focus on practicing anti-racism. And so I want to go into some of those terms to make sure that we are all familiar with what they mean. As far as rethinking strategy, I'm very sure that you all have been having meetings on how do we best serve the community within the constraints that we have, especially regarding COVID-19. So rethinking strategy, that's something that everyone has had to do, even strategy around fundraising, which we will talk about in just a few moments. So strategy across the board, because we are learning that face-to-face interaction has been a foundation of how we do our work. As far as public statements, so several organizations have made public statements. However, these public statements sometimes appear to be a reaction in the sustainability realm. We need to stay relevant and we need to stay important in order to sustain across the community. However, several public statements do not also have accountability attached to them. So if there are public statements made about the availability of public health or health services to all, the response to Black lives, making a statement that your organization values Black lives, there also needs to be a step 1, 2, and 3 that is stated in these public statements as well, about what does that look like in action, and how can the community hold organizations accountable for how they implement these public statements, how they implement the action of showing support for Black lives, how they implement the action of showing support and making sure that everyone they serve receives the health care that they need during this time. You also have value shifts. So every organization has values, and if you are not familiar with the values of your organization, or if you do not have any, I highly recommend that is a immediate conversation that you have with your team, with your coworkers, because the values are the foundation of how you make decisions as an organization. If your values are the health of all of your neighbors, regardless of socioeconomic status, regardless of where they are located and how they can get to you, regardless of their age, etc., which is what a basic statement that we all have as far as anti-discrimination. But in your values, that really states how you're going to address and impact each and every one of these individuals. If you value honesty, if you value action, if you value servanthood within your organization, then there are actual actions you can take based around these values that reflect the true impact of your organization. Diversity, equity, and inclusion, they have been talked about over the last few years, but they're more so coming to the surface in a similar way, as I said, with public statements around accountability. What does it mean to implement diversity? Does it mean that you are just hiring people of all ethnic backgrounds? Does it mean that you are just working with people from all types of zip codes? What does it actually mean for your organization, and what can you do? If you are located in a homogeneous area of the state, what other pieces of diversity can you pull out and ensure? Is there diversity in age? Is there diversity in education that you can also address in your services and in the makeup of your team and your leadership? Inclusion is making sure that everyone has a seat at the table. Everyone has a seat at the table. They're included, okay? And that means included in decision making. That means included in the design of a program, included in the design of the evaluation, that there's real cultural relevance that is considered in your final products, whatever they may be across that public health spectrum, that they're included in the design of the policy brief, if you are working on policy change, that you have inclusion of all voices that will be directly impacted. And equity is something a little bit different. Equity means that you are considering how everyone will be impacted upon the implementation of the program, the policy, or the initiative. And you are ensuring from all facets of that implementation that you are considering and including all of those voices in order to ensure equity. So diversity is making sure there are different voices at the table. Inclusion is making sure they have a voice. And equity is ensuring that those voices at the table who are diverse and are directly impacted by your initiative are impacted in a positive way. And it takes a little bit of work. It takes quite some work. And I am, after the call, going to share some various tools that you can use to measure your diversity, equity, and inclusion across your organization so that you know you are on the right path. Now, practicing anti-racism is something different. So being non-racist means that you are not accepting racism within the workplace. You are not accepting racist policies and practices in the implementation of the work that you do. However, anti-racism takes it a step further and asks that you speak out, that you be verbal, and you actually change policies and practices and implement policies and practices that directly contradict the concept of racism. Now, these can be evident in a few different ways. We hear it more often when it comes to the policy of redlining. If you have not heard of the policy of redlining, it is that way back, maybe in the 50s and 60s, there were certain lines drawn across the community that dictated who could live there, how much they would pay to live there, and whether or not they would be allotted funding or mortgages and loans in order to purchase property in that area. Now, a part of practicing anti-racism is dismantling that type of system. Not dismantling all of the eligibility requirements that your program has, because we understand we work sometimes within the constraints of our funders. However, it is working with funders in order to dismantle those eligibility requirements and those inequities that disable access for everyone that we are trying to impact. Remember, in thinking about impact, you have to impact the least of these, or those who are the most affected, in order to impact everyone. So in thinking about equity and who you're going to impact, you also have to practice anti-racism, which is actively speaking out and dismantling those systems that prevent your organization and prevent you as a professional from making true impact in the community. And so other ways that organizations are responding are along the lines of programming and initiatives. And several of the pieces that I highlighted in leadership also apply to programming and initiatives, but those pieces really should come from leadership, because we know they are the decision makers and they set the culture that builds the capacity within the organization. So along programming lines, as far as how organizations have responded to physical health and social health issues, is the online shift. And I know that it was a spur of the moment, very challenging time for organizations to shift to online services. And if it has impacted how you serve the community because of lack of internet access, because of lack of access to internet-powered devices in people's homes, then that is another piece that you are having to work through as far as, are we being equitable in the work that we do? If we are not allowed to make home visits, how do we really serve the community? And this is a matter of working with the team to build capacity on how to provide online services, but also how to best equip your team to work one-on-one, 6 feet away, possibly, within this new regime that we are in this new world order. So you might have also, in the time being, have had a definition of community that has shifted as well. So your traditional population that you served before might not be your traditional population now, and possibly can't be because of changes in funding. We have seen COVID-19 Passover funds, carryover funds, PPP, loans, all types of funding coming out, not only to support those who are doing the work, but also providing funds for the people that you serve if you needed to shift the work that you're doing. So your definition of community has also shifted because of sustainability, right? In order to remain viable in this climate, you might have had to shift who you serve, and then accountability, reporting back to who it is that you're really serving. We know the unemployment rate across Kentucky has impacted everyone that we serve, but has probably brought in new people into the fold that we have never seen before. People who were once in a socioeconomic status that rendered them ineligible for us to serve them are now coming through the door. So the definition of community has most definitely shifted. Maybe you are removing some eligibility requirements and serving everyone, because at this point in time, everyone is feeling the impact of quarantine, of the public health response. Also, if you are making a response that coincides with the social health, with community and police relations, with the sentiment from the Black community that expresses their need to have organizations address inequities in the system, your definition of community might have shifted because of those things, as well as your focus. So I always tell organizations when building capacity, make sure that it's still in alignment no matter what new path you decide to take. Make sure that it is in alignment with your mission and your vision, which is why it's so important to know the mission and the vision and the values of your organization, because your focus could shift, but you don't want to experience mission drift. And mission drift is where you are now implementing something that has nothing to do with what you have done before or may not be within the capacity of your team. Now, can you train folks on providing services that they have not before that still align with the mission? Absolutely. That's building capacity. But there is a fine line between now opening your focus and expanding your focus to serve more people in the way that you best know how, rather than mission drift, which is doing something that you've never done before but does not relate to what your core mission is. And in this column in programming and initiatives, I echoed practicing anti-racism, where coworkers, teams, organizations are well equipped to call it out if it happens. Not judging, not blaming, but just calling out when it happens, which means you also have to equip the team and build their capacity on what anti-racism looks like. And the freedom that you are allowing your coworkers to hold each other accountable in practicing anti-racism. So now we get to funding. And we know, I mentioned just a few moments ago, that funders have responded, but from foundations to government funds to private donations, they have all shifted into responding to the current health crisis, the current physical health crisis. There has also been dollars that have flowed in regard to improving diversity, equity, and inclusion in response to the Black Lives Matter movement, and then community response to police and community relations. So those dollars are out there as well in order to build capacity. The majority of funding has been dedicated toward maintaining your capacity, right? Ensuring that you can successfully pay the folks who are on your team. For governments, our budgets are pretty much set, so we did not have to worry about those things. However, for grant-funded projects, for nonprofits, there has been amazing support on how to carry forward your work and make sure your team is well taken care of. So the priorities have shifted for funding, sources, and then also spending. Eligibility has shifted. I mentioned that a little bit in the programming and initiatives section. As far as eligibility, it's now expanded. People who have never before experienced the inequities or the trials and tribulations of those that we often write about in our grant applications, they're feeling that now. They're experiencing that firsthand due to lack of income, possibly lack of health care. All of those public health pieces that we have been raising our fist about as far as making sure people are covered, making sure people have access, we are now seeing the results due to the evolution of COVID-19. So eligibility has shifted in funding. They're no longer requiring you, some funders, I won't say all, they're no longer requiring you to submit XYZ to prove XYZ, but rather the applications are simple. What do you need? We are going to give it to you. What do you need? We want to support you in this because this is a state of emergency. So that opens up to new opportunities to expand your mission, new opportunities to create and to envision and innovate ways to dismantle systems, the systems that have set us up to be in the current climate that we are in. So if your organization does have connections with police and community, now is the time to bridge the gap in new and innovative ways. And if you do decide to go along those lines in improving diversity, equity, and inclusion, make sure you have all of those voices at the table. And if you can't find any, if you say, well, maybe there's not a diverse number of voices within my community, I challenge you to find them. I challenge your organization to dig deeper. Build your capacity on the knowledge of where you serve and who you serve. Lean heavily on your community members who are those champions within the community, well known. They've grown up there. They know who to talk to. They are the person to talk to really dig deeper and have the impact that you need in order to maintain sustainability and be accountable. So in that piece of sustainability and accountability, we're often thinking about money. We think about money. How are we going to fund how we move forward? And I said there has been an influx of funds that is coming out, but that may dry up. Okay, there may not be a second round. There may not be a third round. Businesses are stepping up and offering funds as well, but we cannot guarantee the receipt of those funds. So this is really for the nonprofits, or if government, you have a foundational arm and you would like to begin raising money across community, this diagram might be beneficial for you as well. I often like to use this diagram to highlight donor engagement. Because within donor engagement, you're addressing sustainability, but you're also holding yourself accountable to people who have invested in you and organizations and foundations that have invested in you. So surrounding donor engagement, we have messaging. And the messaging speaks to the value shift knowing your mission and your vision. What is the core of what you're trying to share with community about how you are addressing the current climate? And still maintaining the core service that you provide. And there's also motivation at the bottom there. What is the urgency right now? How can you trigger the motivation of a donor to give to you within this time? We know there are a lot of direct service organizations that are receiving a lot of attention, but how can you, as a health-focused organization, also be included in that number? And then there's trust. That's the accountability. Donors must trust you in order to donate to you and give you their hard-earned dollars. So what numbers do you have? What stories do you have? What testimonies do you have in order to build that trust? Are you collecting information and evaluation data with an equitable lens, reaching everyone that you can and that you are equipped to, and seeing results for all so that they can share their excitement and your success with others? And so within the realms of trust and motivation, donors are activated by a realistic ask. So the realistic ask motivates donors to give, and it also says, okay, I trust that you are asking me for the right amount to do what you need to do. And so making sure you know exactly how much you need in order to make this work happen is very important. Right now, there's a lot of requests on Facebook, social media, GoFundMe for amounts of any kind, but there's no accountability. So how do we maintain organizational integrity and build our capacity in organizational integrity? By realistically asking and being held accountable to the community. At the top, I have your impact, which is extremely important. And your impact is known by the community through your messaging, and it builds trust. And so trust and messaging are important components of making sure that your impact is known far and wide in order to improve donor engagement, donations, fundraising efforts. And then, of course, connecting with those who are donors, connecting with their passion. And so your messaging connects with passion, and it motivates donors to give. And so it's also important during this time, as you shift, as you adapt, as you mold what you're doing within the community, to make sure your messaging connects with what is really on people's minds the most right now. And there are people who can give. There are several ways to connect with trust fund managers, different organizations around the community. Your community foundation can absolutely connect you with them. But there are several large donors that are looking and seeking for who to give to right now. And like I said, for government agencies, if you have a community foundation to which the local community can give, I highly recommend that you approach donors as well and incorporate that into your sustainability plan. And so these are all the components here that I have identified as important components to donor engagement that supports sustainability of your organization. And it can fund anything from human resources capacity building to fund capacity building, infrastructure capacity building, actual physical infrastructure capacity building, but then also holds you accountable. So what does the future look like? What does the future look like? So in order to plan for the future, you have to first know what is your mission. And every organization has a mission, whether it is a government organization or a private organization. Every organization has a mission. And it's very important to revisit that and have your team revisit that so that everyone starts off in the same foundation. What are your values? Value statements and values are two separate things. So your values are one word that describe what you believe in, and value statements expound on that word to describe how you're going to act what you believe. And then, like I said earlier, what is your 1 to 2 year outlook? If you have not yet sat down with your team and discussed a strategic plan, now would be the time to do so in order to relieve everyone's stress, one, so that you know where you're going, and then also really identify those gifts and talents within your team that can be used to make the plan happen. Building capacity. And then what is the ultimate outcome? Are you surviving, or do you plan to thrive? It all seems like we're just trying to survive right now, but there is opportunity to thrive. There are new opportunities within the current climate, new opportunities to connect with new people, opportunities to innovate, and opportunities to create within your organization. And then last, is your bottom line based on people, or is it based on profit? This answer defines how you're going to move forward. It defines how you build capacity. It defines who you begin to work with. It defines how you're going to dismantle systems of racism and inequity that have impacted the way that you do your work. And so these are just a few tidbits and tips that I wanted to share with you all as far as what capacity building looks like within this current climate. And it can often seem like people are floundering at this time, just trying to figure out what we're doing tomorrow. We know that there's conversation going on about, is school going to open? How am I going to handle my family situation? What am I going to do about income? And we all have these concerns, and every single one of those are valid. But there's still opportunity with the motivation and the dedication of the team to build capacity for what happens after this. Not only for how you get through this, but also what happens after this. So that was the real theme that I wanted to stress with everyone today on the call. There is opportunity for sustainability and accountability within the climate, and you can build your team toward that end. So I really want to open it up for questions. Michelle, I don't know if any came in while I was talking, but I really want to open it up for folks who have tangible questions about any tools that you need so that I make sure and find what you need after this call. If you want to connect with me afterward and talk more about what capacity building means for your organization, I am more than open to doing that for everyone on the call one-on-one. And so I want to go ahead and open that up for folks.
Yeah, here's a question about the idea you were talking about connecting with new people. In your work and with the organizations that you've worked with, can you think of some strategies or ideas that might be able to help a group in connecting with new people with respect to diversity and inclusion, but also in general?
Absolutely. So regarding connecting with new people, we connect with who we know. And that doesn't mean know personally, but we all connect with the same cultural language, the same places, the coffee shops we go to, etc. We connect with people we know, and that can often be a barrier. So the challenge is to connect with people you do not know, and that means researching if there are small groups meeting that you have never attended a meeting before and made a presentation about your organization. It may take some being uncomfortable to step into situations and to step into groups of people that you haven't connected with before, whether it be the local motorcycle group, whether it be the local Kiwanis Club, whether it be the local fraternity or sorority group. Connecting across age is very important right now. Generation Z, and Generation Z are those who were born after 1995. And I know to some of you, 1995 doesn't sound too far away, but those born after 1995 are very valuable to our conversations of sustainability, and they are a generation that focuses on accountability as well. And so it's a matter of saying, hello, my name is, and I would like to speak to your group. Like I said, it will feel uncomfortable, and it may make you nervous, and you may hear no the first time. However, if you come with the mindset to not only serve, but to learn, that is a way to bridge the gaps in diversity, equity, and inclusion. So there was also another question. A values conversation can be hard for individuals or organizations. How can we get started? So when approaching the values conversation, you first have to set the connection within the team. So that's where team building comes in. Because once you break down the barriers of, oh, we have nothing alike, we're different people, etc., you then begin to find commonalities. And through finding commonalities on a personal level, you can begin to have the values conversation on a professional level. And so what I like to do is I like to take teams through a series of exercises that brings them to the point where they are more cohesive and have a foundation on a personal level. And then we're able to have the tough conversations about values, because everyone is bringing different values to the table personally. And it's true, these conversations can get heated. They do get a little bit heated at some tables. However, if the mission is kept in mind, we can always come up with the values that we're going to use in order to enact the mission. So there's another question, self-assessment and evaluation. Can we do that internally, or should we have external review? So self-assessment, yes, you do it internally. And I will say self-assessment can be done internally because we always score ourselves lower than what we may actually be. Sometimes we're harder on ourselves. Other people may boast that they're not. But sometimes we are harder on ourselves. However, external evaluation is also very important, especially when you're looking at external evaluation of diversity, equity, and inclusion. It's important that people are objective. Very objective, because when you do internal assessment of diversity, equity, inclusion, it often gets personal, and it does. That's a real dynamic that happens in those conversations, in those situations. So external evaluation of those pieces that evaluate how you interact with other people is what I recommend. But self-assessment also complements it so that you can get a good view of how you view yourself, as well as how you're viewed from the outside. That was a great question. I see others popping up, but Rochelle, I might not be able to. Can you give the definition for capacity building again? So capacity building, Teresa. Oh, I got people's names. Okay, so capacity building is really building the skills, the knowledge, and the behavior of your team and your organization. And that happens in several different ways. I do it through strategic planning, through evaluation, through leadership development, specifically board development, as well as through fund development, and working on partnerships and networking. I have colleagues who work specifically on team building and leadership coaching. So that's that one-on-one, in-depth, interpersonal work that needs to be done, which sets the foundation for building the organization. Because that team building and the leadership coaching also sets the stage for the values conversation as well. Is there another question? Everyone is talking about cross-sector work. What are some examples of cross-sector work? What should the goals be? How do I get started? Yes. So cross-sector work is I love cross-sector work. So I was able to work on a collective impact project I am in Louisville, Kentucky. And cross-sector means you are working with housing, right? All the root causes of health. Let's go back to our first lessons on public health and what the root causes of health are. Housing, law enforcement, food security, health care, as well as mental health care. So all of these sectors were at the table, and we were focused on maternal and child health. So when you're doing cross-sector work, you still have a goal in mind. You know, if your thing is, if your initiative is, we are working to make sure that everyone has health care. Let's go back to when the whole state did the entire campaign on not universal health care, but Kentucky, I'm losing the name, but you know what I mean. So with that means you would recruit different sectors that touch people. So if it was LMPD, every time they made a run or every time they had an event, expanded Medicaid, thank you. Every time they made a run or every time they had an event, they would inform people about it. With housing, not only would you receive the housing services that you need, but you would also receive information about expanded Medicaid. Not only would you receive the food that you needed from our different food security partners around town, you would also receive information about Medicaid. Not only would you receive the utilities that you need through your local fund, whatever that may be, if you need money for LG&E or Kentucky Utilities. You would also receive information about Medicaid. So in a collective impact model, I will say that's one type of model of cross-sector work. It's every single partner, no matter what sector, is focused on the same thing, and they do something, one thing. It doesn't have to be a huge initiative, but every sector is doing something to work toward the same goal. So you choose the goal. And you choose your goal based on your current statistics, right, within your community. How many people are smoking? How many people have heart disease? How many folks are affected by poor maternal and child health, infant mortality? You know, all of these pieces that we measure and that also the foundation has measured as far as the state of the state regarding health statistics. What does it look like for your county? What does it look like for your area? And then you choose the goal that will have the most impact for the community. You can also, in choosing the goal, ask the community, what will have the most impact on your health? Having public input sessions, that's a piece as well. If you're going all the way back to even choosing a goal, hosting public info sessions, now they would be online. So that does exclude a portion of the community. But you would also have people go door to door asking the same questions that you would of a focus group that you would have online. So there are a variety of different ways to begin that cross-sector work. Is there another question? Or are those all the questions that we have? Oh, no, I was muted. Michelle, are you there?
Dawn, I wasn't having any trouble hearing you. I know sometimes, depending on connectivity and things like that, it can go in and out. We will have the webinar recorded and posted to the Foundation's website, so apologies for the answer. So, Stefan, if you want to take a moment to just review again your answer to definition of capacity building again, to review that for us, since it is definitely the theme of why we're here today.
Yes. So the definition of capacity building is improving the knowledge, skills, and behavior of your team. And so that takes place in a number of ways, through strategic planning, evaluation, fund development, leadership development. I hope you heard that, Teresa.
Yeah, perfect, Devon. That is great. I would love if you want to give a final conclusion or points for us to think moving forward, and then I'll wrap up our call in just a moment. So share with us a challenge or things you can think about moving forward.
Absolutely. So capacity building is the theme of capacity building is don't forget about your team. Don't forget about your team. We get bogged down with the work and doing the work, and we need to remember the team. The team must have the knowledge, which is the strategic plan, knowing their roles, knowing their responsibilities. They must have the skills, being equipped to fulfill their responsibilities and their roles, and the behavior, making sure everyone is operating under the same values and the same mission in order to really have the best impact within the community. So I encourage you to reach out to your local community foundations. I encourage you to reach out to capacity building funders across the nation. I encourage you to even use some of the funding that you may have received during this time in order to develop and work on the capacity of your team. So thank you all so much for tuning in. If you have additional questions, Rochelle is more than free to share my information with everyone. I only gave my website, but you can also contact me at my email address, which is info, I-N-F-O, at Chenault.solutions. Chenault.solutions. There's no .com, it's .solutions. So Chenault.solutions. You may also call me at 502-922-6683. Thank you.
Thank you so much for your presentation today. You gave me so many great ideas, reminding me about community and having dialogue with community, and that's exactly what this series, Health for a Change, is. It's dialoguing with all of the folks across Kentucky who are advocates and community members and hospitals and health departments so that we can all learn from each other, share ideas, learn from our mistakes, and move forward to improve the health of Kentuckians. Thanks, Devon, for the reminder about values. You can find the values and mission statement of this organization, Foundation for a Healthy Kentucky, on our website. Check out the About Us tab. The slide deck, the recording will all be posted at the Foundation's website under the Health for a Change tab. Finally, Devon talked about evaluation and effectiveness. I will send you an email this afternoon with a link to a post-survey webinar. Please, if you would take a few minutes today to tell me what you thought, to give suggestions for future Health for a Change webinars, or speakers that you would like to see, I welcome your ideas because, again, this was the theme that came forward for me in today's conversation about community and challenging and thinking about our values and engaging in that conversation. And I'm very honored to coordinate this training series. And I'm so honored to have had Devon Edwards here with us today. She gave her email address and cell phone, and I will also put that in an email to all of the participants here today. Again, my name is Rochelle Seeger. Glad to work here at the Foundation for Healthy Kentucky. Please feel free to contact me with your ideas, questions, criticism. I welcome all of those things so that I too can do better at this work. This training series is all about partnerships and community. I thank you for joining us and spending an hour with us here today. I look forward to seeing you on the next webinar. Be well. Have a great day.